Welcome to CGTN's social media platforms. I'm Silkina Ahluwalia, CGTN's Indonesia correspondent. Thank you so much for joining us this morning. Today we have a very interesting topic. It's a little bit formal, but we're going to try to have a casual chat. It's going to be very informative. We're going to be talking about the digital health industry here in Indonesia and globally as well, and what is the progress, what does the industry look like here, and to help me understand this and more, we have our expert, Fajar Wibowo. Thank you so much for joining us.
Thank you for inviting me.
We're very excited to talk about this. Obviously, digital health is new not only in Indonesia, but across Asia and globally as well. But before we talk about digital health, let's talk about Indonesia's health industry minus the digital. What does it look like now? What are some of the improvements that have been made? Things that are worth, celebrating, mentioning?
Okay, so basically in Indonesia, as one of emerging economies, the issue about health itself is the transition of epidemiology from communicable disease to non-communicable disease.
Which, what are some of the examples of communicable diseases?
Communicable is like tuberculosis, HIV, influenza, and so on. Meanwhile, now people are mostly dying from heart attack, stroke, cancer, and those causes. And this is not good for the growth of Indonesia's economy because people die from such disease are getting younger. Especially those people are now working as senior management level in the industry or even public institution. They are holding these pivotal roles in the institution. So if we lose them, we might lose many economic potential. And
it affects our economy.
So because eventually.
So when we talk about dying young, we're talking about these people dying at age, what would you say, 30 above, 35, 40?
35 above 40 while they're at their early productive age and at senior management level.
And that's not good. That's not common. That's like something that
you don't expect that to happen. Actually.
I mean, we always say that when we're young, we're active. We don't expect people to die younger generally.
The thing, because with urbanization and economic growth that is very fast happening in Indonesia, people tend to move less and eat less vegetables as well. So this unhealthy lifestyle habit that we uptake, actually the most important contributing factors.
So really high fat content. The bad fat, like fried food, and not enough vegetables, obviously. So when we talk about digital health, what does digital health mean in general?
Digital health is actually the utilization of digital technology to access health, be it the health service, the physical health service itself, or health information. In Indonesia, the culture of accessing health information for preventive and promotive purposes is not there yet. So people will seek only healthcare facility when they're about to die, when they are
when they have to drag themselves to the hospital.
Exactly.
Once it's worse, then they're like, this requires me to go to the doctor.
Or probably among the girls and among mothers, they will seek information when they got pregnant for the mothers, and for teenagers when they start to have either sexual reproductive health issues, or probably they want to have more information about how they could maintain their sexual health, because it's of issue that of their interest, basic interest. So if we want to promote an healthy lifestyle, we can start from there, because there are of audience that deliberately seek for health information digitally.
And what does the digital startup in Indonesia look like? Do we have a lot of startups that are popping up in the past few years? Like, what are some of the common startups that we're seeing here?
If you look at the Google Play Store, it's actually very indicative and very intuitive, telling you what are the most accessed platform nowadays. There are HaloDoc, HelloDokter, KlikDokter, and so on. They are eventually targeting different markets, different segments, and they are learning also different habits of audience in Indonesia in terms of accessing health information.
So maybe we can check out some of the websites that are available here. Okay, so let's see. So the first one, we have HaloDoc, which is, I guess, one of the most common ones. So I guess when you open, so HaloDoc has a website and also a mobile app, right? So when we open the website, what are the first things we can see? I guess when you talk about digital health, it's about being able to directly communicate with your doctors 24/7. So like you were saying that a lot of people in Indonesia will not go to the doctor unless they're very sick or they, you know, unless they're dying. But by having applications like this, even if they have a little discomfort, they're able to immediately ask their doctor, is everything okay with me? Maybe we can just go through the site here. So it's usually on the mobile app, but you can see that it's really easy to contact your doctor. They even have a pharmacy delivery service. So it's like you contact your doctor, tell them how you're feeling, and if your doctor's like, you know, you don't need further checkup, maybe you just need this type of medicine, then I guess you can immediately get your medicines delivered. And this says in Indonesian, but it says quick, safe, and what is that? Comfortable. And this one said trusted, and this one says anytime, anywhere. So we actually spoke to a HaloDoc representative, and they say that one of their most common consumer, or basically a patient that talk to the doctors, are mothers, and you mentioned that, which is basically, I guess, mothers who have kids, or you know, pregnant women. They are a little bit more. Yes, I was trying. I was trying to find the word. I didn't want to be rude. It's not like it's not hypochondria, but it's like, you know, you feel like something's wrong with your child, and you're like, I just want to make sure that my child is okay before they go to a doctor, because Jakarta is, you know, 10 million people. It's congested, and even getting to a doctor is about an hour, and then you wait for your doctor. It's about an hour, and then inside the doctor's office could take another 30 minutes or so, and then you wait for your medicine, and that's another hour. So it's like a 5-hour thing. It's like a whole day thing. And most people have to take a day off when they go to a doctor, and they just don't think that it's worth it, which is why applications like this or websites like this really are transforming the digital health industry here. We have another one that we want to show, which is KlikDokter. Yeah, is it similar to HaloDoc?
Yeah, basically they focus on the access to health information. So for professional working in offices, they don't have time to arrange appointment, or they have very initial complaints of physical situation, medical condition. They can always grab to talk with any doctors there. Usually it's related to your work performance or your skin complaints, things that you can intuitively see happening on your body.
And you can take a photo or something, and you can show the doctor if
later. I think they are developing it. Mostly it's chat based, and they don't require physical contact. That's why they can mostly serve the initial complaint of your medical condition.
And that's the whole point of like digital health. It's that you don't have to be in the same room, but you can still get consultation.
Meanwhile, people can get they can put you at ease. Because you know, you don't need to be stressed out because of complaints.
You don't have to. Like, don't Google your symptoms. Because seriously, I've done this, and it just makes you even more paranoid.
Well, Google is working very hard actually to build the algorithm, so that they can feed only credible information to the audience. I knew that.
Okay, that's good, because it's like you start with a headache, and then you Google it, and it's like headaches could lead to so many things. And it's like suddenly, and then suddenly you're like, oh my God, am I going to have a heart attack? Am I going to have a stroke? No. So just ask your doctor, and then this is good. You get a doctor's opinion. Literally anytime, anywhere. Okay, so we're nearing the end of 2018. What would you say were some of the big achievements in the Indonesian digital health industry this year?
I think what's a good take from the digital health enterprises so far, they took some time to learn the audience, the market, and the behavior of its market. Probably they have started since 2008, some of them, like KlikDokter and HaloDoc started a bit later. But along these 4 to 8 years, they have learned quite a lot of things from the behavior of the markets, and they start to targeting which markets to sell the service eventually, and what kind of service they need to offer to the audience. And for the next, actually, what is the most important is to support the healthcare industry itself, because eventually digital is of supporting technology. Of
course.
It's not a core in itself.
Yeah.
So how this digital enterprises could collaborate with physical healthcare industry is the most important things to move this digital technology forward in healthcare.
Yeah. In that sort of area, you kind of tapped into a little bit of the challenges that we might face in the digital health industry. But what do you think are some of the most common challenges? I would think that connectivity, I would say, like internet connectivity, which has to do with the broader term, I guess, would be infrastructure. So it's like the challenges are really broad, but when you narrow it down, what are some of the challenges?
It used to be the biggest challenge back probably 3 years ago, but now the government of Indonesia has deployed a strategy to establish a tower for internet to provide internet access in this even sub-district level. So every sub-district level down, they can have internet access. Even I used to be working with primary healthcare back in Sorong, Papua, and they can access internet there. There is Facebook, YouTube, and so on. So internet access won't be a matter in the future, at least for Indonesia. What would be challenge actually understanding the market. Because most of the resources, be it the capital or the technologies who come to these digital health enterprises, usually come from high-level background. Either they come from developed countries, neighbor developed countries, or from probably Europe or China or Singapore, which has very little background and exposure to Indonesian market. Meanwhile, Indonesian market is very broad and they are very segmented. And each segment has its own behavior and interest. It's
hard to categorize like Indonesians as one. Like it's impossible. Even when we talk culturally, it's like, like you said, it's very segmented and everybody has their own lifestyle, their own,
True. And economically, when we talk about mid-level of socioeconomics of Indonesia, it can be easily or immediately compared to those of Malaysia, Singapore, Thailand, or other neighboring countries, or even more to European one or China. So that's the thing that we really need to be very careful and then to be very patient to understand what's the need of our market exactly, so that we could serve better.
What about convincing, I guess, the older generation to start using these apps? What would you say is the target market? Do you think it's just the younger generation, maybe 18 to 40? No, or do you see a lot of the older generation also using these types of apps?
Small fraction of older generation may adopt that, especially those coming from high-level economic background. But with those without those level, we need intermediary young generation to cater them to fit with the service that we offer through digital technology.
And you mentioned that KlikDokter was founded in 2008?
2008.
That's actually, that's a long time ago. 10 years ago.
They started with blog, I guess, healthy lifestyle blog.
Oh, wow. And how have you seen the digital health industry evolve in this past 10 years? You are one of the co-founders of KlikDokter.
I actually joined a bit later, but I was part of a similar project with Nokia in 2009 to 2011 when Nokia started to employ their health literacy strategy for market in Africa and Asia, especially Ghana, China, Nigeria, and Indonesia. So I could sense how the market has evolved into and how they slowly get mature. And KlikDokter has taken the lesson very, very, very seriously, and they has evolved from healthy blog to chat-based and e-consultation, meaning message-based consultation through email-like platform. It was not email, but it looked like an email. And then now they transition to live chat basis, 24 hours. 7 days a week, and
wow.
They even
There's a doctor on standby.
Yes,
anytime.
Yeah. And they even work with BBM, BlackBerry Messenger.
Yeah,
yeah, and also one of Indonesia's largest media. So yeah, they took it very seriously to nurture the market of Indonesian people who want to access health information. Yeah.
And how do you see this digital health industry moving forward in the next 5 to 10 years globally? Where do you see it moving towards?
Yeah, actually interested to combine this with my view on regionalization, the ASEAN economic community, where the mobility of people in Southeast Asia is tend to be more active.
Yep.
And we can see that now number of people seeking for care abroad, cross-border, we call it cross-border patient in terms of health system framework, is increasing. Previously in 2006, it was only 50,000 Indonesians seeking for care in neighboring countries like Thailand, Malaysia, and Singapore. Yeah. But it has grown to 250,000, 5 times in 2011, when the low-cost carrier is introduced in the market. You can name a few of them. They're very famous, and some of us take them to fly to another country.
So accessibility.
Accessibility, and then the second point is the shared culture, because we tend to speak and eat similar food, speak similar language and eat similar food, and we tend to have a trust level that is pretty much in the same frequency. And then also historically, but before the access is not there, and now the access is there with the low-cost carrier.
So it's so easy.
So easy, and now the information is even there too with digital information access.
When we talk about Indonesia, what potential do you see in Indonesia's digital health industry in the coming years?
Yeah, in the coming years, with the expansion of physical healthcare industry in Indonesia itself, the rise of hospitals and laboratoriums, service like medical checkup and also medical consultation will be of potential market to nurture, and digital information will be very handy to support the promotion of those services. Actually, today we already have a few of them. And I think it will be the future for the healthcare industry supported by digital technology.
Do you want to talk a little bit about Smarter Health?
We
could probably show some of the... we are actually on Facebook, so if you have any questions, we're going to take some viewer questions. I'm just opening the Facebook page so I can read some of the comments. If anybody has any comments, if you have any questions that you want to ask. Fajar is a digital health expert, so he can answer all of your burning health questions if you have any. It's probably a little bit early. Is everybody still sleeping? No. So what is Smarter Health? If you want to introduce it a little bit.
Smarter Health basically they try to bring back the authority to the patient eventually, because patient is the one who would say to go or not to go with the medical procedure. And then also who decide what kind of healthcare facility that they want to access, and eventually the true customer of the healthcare industry. And
we have an internet problem.
Okay.
Is it slow? Oh, there it is. We're open. If you want to see it. Okay.
So Smarter Health offering access to services like medical checkup to prevent you from being ill. Also consultation to put you at ease if you have medical complaint or medical situation that you are unsure about. And also smarter treatment, meaning you can always be informed about what kind of medical treatment, what kind of treatment plan that you would receive from your medical doctors. And it provides information from hospital all over Singapore, Indonesia, and Malaysia.
And these are some of the partner hospitals?
Partner hospitals. So the basic idea of this digital enterprise is actually to give the true information to the patient, which kind of medical specialty or medical service that you eventually need to access. And with estimation cost upfront, so that you are better informed which decision you want to make, which hospital you want to go to, and which doctor you want to see, and which medical procedure you eventually want to receive.
All right, Fajar, thank you so much for joining us and educating us on digital health. It's really exciting to see. I mean, technology is basically transforming the way we do everything, including sleep. You can even track your sleep now. So, you know, it's really exciting to see we've had smartphones, and now we have smart health. So thanks to technology, it's making things so much easier. You can now talk to your doctor 24/7, at least here in Indonesia, with your cell phone. So that's really easy. Thank you so much, guys, for joining us. And if you have any more questions, I will try to answer them in the comment below with the help of Fajar, obviously. I'll see you guys next time.
Bye.